What kind of IUD should I get? IUDs have gotten to be a lot more popular in the last few years as a form of birth control or to help with heavy periods, but there's many different types of IUDs out there. So in general, there's two major categories of IUD, hormonal and non-hormonal. So the hormonal IUDs release a small amount of progesterone only, really just at the uterus. So it doesn't tend to go through the whole body, it doesn't tend to cause really any other side effects other than changes in bleeding pattern. So when someone gets a hormonal IUD, at the beginning, they may have some irregular bleeding. It's kind of hard to predict for the first 1 to 3 months, but usually should get much lighter after that. And for many people, the period actually stops completely. Whereas the non-hormonal IUD, the copper IUD, the Paragard, doesn't release any hormones at all. So someone will still get a regular monthly period. Also doesn't cause side effects because there's no hormones. But sometimes people find that their periods may be a little bit heavier, a little bit more crampy with the copper IUD. For the hormonal IUDs, there's different types. The one that most people might have heard of is the Mirena IUD. That one recently got approved up to 8 years for contraception. Then there's other types of IUD that are a little bit smaller, a little bit lower hormones. So the Kyleena and the Skyla. Kyleena is approved for up to 5 years and the Skyla for up to 3 years. It's really a personal decision what IUD you want to get. You may, if you get the Skyla or the Kyleena, you may notice a little bit more spotting or bleeding, whereas the Mirena is going to be kind of the best chance at no bleeding whatsoever. But that being said, some people prefer the smaller IUD with a little bit lower dose of hormones. Other people really like the idea of no hormones at all and prefer the copper IUD. So it really is a personal decision that you can talk about with your OB-GYN. But patients really love IUDs, and I'm gonna do another video on what to expect for IUD insertion.